Hello everyone, welcome back to US Medicose. In this lecture we will discuss about breast abscess. What is breast abscess? It is the formation of abscess and pus in the breast which makes the mother look ill and the breast is more painful, enlarged and edematous. Actually breast abscess कहते हैं breast के अंदर पस का इकट्ठा हो जाना, रेशे का इकट्ठा हो जाना, जिसकी वजह से मदर जो है इल फील करती है, डिसकम्फर्ट फील करती है, ब्रेस्ट बहुत पेन होती है उसके ऊपर, और इसके अलावा ब्रेस्ट इनलार्ज हो जाती है, एडिमाटोस हो जाती है। इसकी स्टूडेंट कुछ कॉजेज़ हैं जिसकी वजह से ब्रेस्ट एब्सेस होती है। फर्स्ट ऑफ ऑल पे इसकी कॉज है बैक्टीरियल इन्फेक्शन। Bacterial infections enter through the cracked nipples, through the pores of mother nipple and through the mouth of baby. The other cause is when the mothers do not maintain proper hygiene, then breast abscess are formed, and when the baby do not drink lactation, do not drink mother milk, then the breast abscess are formed because the milk is stored in the lactiferous duct which caused the abscess. Now we will discuss about the clinical features, signs and symptoms of breast abscess. First of all, the breast is breasts are painful, redness are feel on the upper skin surface of the breast. The temperatures of the breast are high. The area of the breast abscess, warmth. You can also feel tenderness on the breast. How we will treat the breast abscess? First of all, the patient is to provide health education, provide proper nutrition, then the antibiotics are used for 7 to 10 days. If the patients do not respond for the antibiotic, then there are the minor two surgical methods. First methods include when the needle is put into the breast and the pus are drained from it. This is called the first method. And the second method is that the incisions on the breast and pus are drained from the breast. उम्मीद करती हूँ वीडियो आपको पसंद आई है। चैनल पर फर्स्ट टाइम है तो प्लीज़ सब्सक्राइब कर दें, लाइक कर दें और बेल आइकन पर क्लिक कर दें ताकि आने वाली हर वीडियो आपको मिल सके।